The typical signs and symptoms of a patient with cervicogenic headaches is the following. One of the most common things is having what we call unilateral, meaning one side only pain in the back of the head and or neck. So that pain may be right at the base of the skull. It could be sharp pain or it could be a dull ache. That pain could be kind of coming down the neck, maybe even into the upper trapezius muscle region. But that's typical area of pain for a cervicogenic headache. It can also be shooting pain that shoots up over the top of the head, and a lot of times we call that like a ram's horn type of headache. So the pain comes up over the top of the head and may even land into deep retroorbital eye pain, or we'll call it retroorbital as a term that means back of the eye pain. So these symptoms that are on one side of the head or neck, deep in the eye, or can be deep behind the ear, as we see here, it can be cervicogenic headache coming from the upper two cervical joints in the neck. We call it O1, the occiput in C1, or C1 and C2. So these joints, if they're stiff, they can reproduce those symptoms. So now, there's a bit about the symptoms. Now the signs. A typical signs of a cervicogenic headache is typically one-sided, so the pain is on one side. The movements or the postures of the head and neck can bring the symptoms on, as well as it can take it away. And a physical therapist can reproduce the symptoms with palpation, like we stretch your neck or poke on specific vertebrae, and if those palpation findings reproduce your neck pain, it's a likely cervicogenic headache.